Hi everyone, my name is Jorge Trujillo. I'm a PhD student in microbiology at the University of Nottingham in the UK, and this is my 3-minute thesis competition. I am working in something called toxin-antitoxin systems in gonococci. Gonococci is one of the names given to the bacteria Neisseria gonorrhea. Neisseria gonorrhea, this bug, is the causal agent of gonorrhea, the sexually transmitted disease. The reason why we are particularly interested in this bug is because in the last 7 years, the UK and the US have reported an increasing amount of patients with gonorrhea that turns out to be multi-antibiotic resistant, including the latest generation of antibiotics that have been released to the market. This just deepens the public health issue about antibiotic resistance. And why are we interested in toxin-antitoxin systems? Well, first of all, we have to explain what is toxin-antitoxin systems. Depending on the source, there are between 6 and 8 different types of toxin-antitoxin systems. We are interested in type 2, and the reason for this is as follows. First of all, when we're talking about human pathogenic bacteria, or in other words, pathogens or bacteria that can potentially produce sickness or death to humans, when we're talking about this kind of microbes, this kind of type 2 toxin-antitoxin system is widely distributed among them. This makes it also the most studied kind of toxin-antitoxin system. And in the third reason, you will ask, okay, if bacteria has toxin-antitoxin system, that means, as we know, we have bacteria as well inside of us. It is called the microbiome. Is it going to be also something that is going to be affected to my microbiome? The beautiful answer is no. Because while type 2 is widely distributed among pathogenic bacteria, type 2 toxin-antitoxin system is almost inexistent in our microbiome. Our microbiome normally presents type 3. So this is a really good chance and a potential target for innovative therapies. The reason for this is, for example, when an infection takes place, antibiotic has to be given. But the antibiotic does not discriminate between which bacteria is the physiological one, is the normal one, and which bacteria is the one that is making you sick. It just kills the bacteria around it. And our research is important because if we can exploit this capacity of the microbes of doing their own toxin, that's why the name toxin-antitoxin system, if we can somehow learn how to induce them to create a toxin, then they will get intoxicated by themselves, and it is something that will respect our microbiome, and it is a novel approach to antibiotic resistance. Thank you.